Hi, I'm Dr. Christiane Northrup, an OBGYN physician and authority on everything that can go right with your body. And I'm here to tell you how to transform your health and truly flourish while making your life easier. In Western medicine, drugs are created to treat symptoms as opposed to treating the root cause of the condition. If you only suppress your symptoms instead of also addressing the cause, your body will often protest by developing so-called side effects to medication, or even by developing another disease. Many of the most popular drugs being prescribed for millions have significant side effects that just don't outweigh the risks. This is how our bodies talk to us. But there is nothing about side effects. They are effects. They are the direct result of the drugs. In this video, I'm going to share which frequently prescribed drugs I personally would not take and what I would recommend instead. So, drugs I wouldn't take. Let's start with statins given for heart health. These are prescribed to lower cholesterol. Here's the myth. Lowering cholesterol is the key to preventing heart disease. The latest research shows that it's far more complex than that. Statins deplete your body's coenzyme Q10, also known as ubiquinone. It's a vital nutrient for producing energy in the cells, particularly in your heart. Your body makes less coquinone as you grow older. Low levels of coenzyme Q10 are linked to depression, dementia, muscle weakness, fatigue, pain and nerve damage, an increased risk for breast cancer, all of which are known side effects of statins. Your heart requires coenzyme Q10 to function properly. So why take a medication for heart health that depletes a vital nutrient shown to support the heart when you can take one that supports every cell in your body? So how do you protect your heart? You eat a healthy diet that isn't necessarily low fat. It needs to have healthy fat. Take supplements, especially antioxidants. Get enough vitamin E to keep your blood platelets slippery. And have the courage to look closely at any source of emotional pain, broken heart syndrome, and heal it. So heart disease is way more than taking statins. Here's another drug, biphosphonates for bone loss. These drugs are prescribed for bone loss and osteoporosis. They include Actonel, Boniva, Fosamax, Aclasta. They prevent bone breakdown and therefore bone loss. But here's the problem. They interfere with the natural cycle of breakdown and restoration that bone goes through, and the result is you get older, porous, brittle bones, which increase the likelihood of fractures. Biphosphonates have significant side effects, including back pain, joint pain, stomach pain and ulcers, nausea, vomiting, heartburn, constipation. Here's the one that really scares me. Osteonecrosis of the jaw, death of bone tissue in the jaw. Dentists will tell you that they see an increase in root canals after someone starts a biphosphonate. You also can get atypical fractures of the femur that don't heal. So I've told you about the dentists, and this is something that I would really be concerned about. Here's why. These drugs stay in the system indefinitely. No one knows when they go away. We don't seem to have a half-life. So women who already have osteoporosis may benefit, but I want you to protect your bones much earlier, and that means promoting bone health naturally. So how do you promote your bone health naturally? First of all, know your body's consistently and constantly renewing itself. The older you get, cells are eliminated by the body so that newer, healthier cells, including bone cells, can take their place. Bones go through this cycle too. If you have decreased bone mass, your body is breaking down bone faster than it's creating new bone, unless you're one of those people who had bird bones when you were born. See, that's the problem with the bone density testing. It might show you in the lowest 25th percentile, but that's because your bones are small to begin with. It's not bone density per se, it's bone quality that predicts fracture. And unfortunately, the bone tests don't show bone quality. You need to get plenty of magnesium. I know you're told you need more calcium. Not true. Calcium isn't nearly as important as magnesium, which is deficient in many, many people. Make sure your vitamin D level is optimal, not just enough to prevent rickets. The vitamin D that you need to take for an optimal range generally is 5,000 or more international units per day. The optimal vitamin D range is 40 to 80 nanograms per milliliter. You need to eat a more alkaline diet, a lot of vegetables, do plenty of weight-bearing exercise, and consider, if you need it, bioidentical hormones or plant hormones that have estrogenic effects. Another drug that I wouldn't take is synthetic hormones for menopause. I've been talking about bioidentical hormones that actually match those that your body produces for nearly 3 decades. And I'm still surprised when women and their doctors do not know the difference between a bioidentical hormone and a synthetic made in the lab one. Bioidentical hormones are created to be an exact match for the molecular structure of the hormones your body makes. Yes, they start with wild Mexican yams and soybeans, and then in the lab they make the stuff that matches what's in your own body. Now, so-called synthetic estrogens are in all kinds of birth control pills and all kinds of things on the market. Premarin is a bioidentical hormone for a horse because it's made from horse pee or horse blood. Hence the name Premarin, P-R-E, pregnant mare, Premar, and mare's urine, Premarin. Just take a pill of Premarin, put a drop of water on it, and smell it. If you don't think that that's horse urine. That's what it is. Okay, synthetic progestin is derived from bioidentical progesterone, but you can't patent a naturally occurring hormone. So they change it. They add different groups to market it, and it's not native to your body. So guess what? If it's nothing your body has ever seen, your body has all kinds of funny things that it does with it. So there are risks to synthetic hormones. For about 2 decades, Premarin, which was the first estrogen really to be widely available, and Prempro, that's Premarin plus Provera, were the gold standard. And a one-size-fits-all approach was what we offered to all women. In the early 90s, we started the very famous Women's Health Initiative, and I said back then they're using the wrong hormone at the wrong dose and they're not going to find out what they want to find out. And what happened? 2002, they stopped the Women's Health Initiative because they found that these hormones were actually increasing the risk of stroke and heart disease. If they had used bioidentical, I think it would have been different. What they used increased blood clots, strokes, heart attacks, and even incidences of breast cancer. So, the best approach for hormone replacement is either a plant hormone or a bioidentical hormone that exactly matches what's made in your body. So, pay attention to how your body feels. And I find, by the way, that it's far more accurate for hormone balance to just see how you feel, because what I've noticed is that if you get your hormone levels tested and so on, hormone levels vary throughout the day. So you use the lowest dose possible of a bioidentical or plant hormone and see how you do. That's the way to do it. And an even better approach to balancing your hormones, change your diet to a low-sugar organic food approach. Add a natural herbal remedy such as Pueraria mirifica, maca, black quahash, ground golden flax seeds, or chasteberry. There's so many herbs that have worked for millennia for women. And if this doesn't work, then go to the bioidenticals. And remember that hormone therapy is an art, and it can take a few trials and errors. It's a work in progress, just like you. And you might have to change every year. There's another drug, the proton pump inhibitors for acid reflux. 15 million Americans use the proton pump inhibitors, the purple pill, to treat heartburn, acid reflux, gastroesophageal reflux disease, GERD, peptic ulcers. And these are often prescribed as a first line of treatment because they reduce the amount of acid in your stomach. Brand names include Prilosec, Prevacec, Nexium. Proton pump inhibitors are among the most commonly prescribed drugs in the world, and they are some of the most dangerous. People have no idea how many vital roles stomach acid plays in our bodies. And the catch-22 of these drugs is when you stop taking them, the amount of acid your stomach releases surges and causes your symptoms to worsen. The dangers of proton pump inhibitors include increased risk of bacterial overgrowth. Stomach acid is what keeps harmful bacteria, such as Helicobacter pylori, in check. When you don't have enough stomach acid, it impairs your ability to absorb vital nutrients. You need stomach acid to absorb calcium and vitamin B12. Also, these things cause magnesium deficiency. Calcium imbalance can cause magnesium deficiency, and the result is leg cramps and muscle weakness. How many of you have leg cramps? Lots. You need more magnesium. Also, the proton pump inhibitors put you at risk for osteoporosis, a weakened immune system. Your bowel wall contains nearly 2/3 of your body's immune defenses. They're called Peyer's patches. You need enough acid to keep harmful microorganisms and toxins from reaching other organs in your body. This begins in your stomach. If you constantly take these drugs, you're changing the ecology of your gut. And this can ultimately adversely affect your immunity, putting you at risk for diseases such as cancer and dementia. My recommendations for eliminating heartburn, GERD, and other acid-related problems. First, lifestyle changes. I'm sorry, you have to change the way you live, and your body will love you for it. Lose weight, eliminate food triggers, eat lots of vegetables and fruits and high-quality protein. Try an elimination diet. Okay, so here are common culprits: gluten, corn, soy. Some other foods may cause gastric discomfort. Eliminate alcohol and caffeine. Eliminate sugar, all forms of sugar. Drink lots of water. And then add back one of those foods at a time and notice if there are any symptoms. Generally, high glycemic carbohydrates are the culprit. So that would be a morning breakfast of coffee and a donut or coffee and a bagel. That's a setup for heartburn in susceptible people. Some of you may need hydrochloric acid supplements. Most acid-related symptoms are caused by too little acid, not too much. Anyway, you need digestive enzymes. Look for a pH-balanced, full-spectrum formula such as Wobenzyme. Good quality sea salt helps, a good probiotic. Restore your gut if you've been taking these proton pump inhibitors. Get off antacids. Stop taking Tums, Mylanta, Pepto-Bismol. Some antacids contain magnesium hydroxide, which can cause diarrhea. Antacids made from calcium carbonate, Tums, can cause acid rebound. Now, it's not a problem if you take this just occasionally, but over time, these can contribute to kidney problems. Also, taking acid blockers like Zantac, Pepcid, and Tagamet can be a problem. If you need to take one, just make sure it doesn't contain aluminum. They can cause constipation. They may reduce phosphate levels, which can result in fatigue and loss of appetite. Aluminum consumption contributes to Alzheimer's disease. You need to listen to your gut. Your gut health, your emotions are deeply linked. The gut is a secondary brain. It produces more chemicals than this brain. More of the chemicals that the brain makes when it thinks are produced by the gut than the brain. Butterflies or nausea are often your inner wisdom speaking to you. Keep a journal of your symptoms to help you determine what factors may be associated with problems. And remember, no drug is 100% safe. That doesn't mean you shouldn't take one if you need it, but you should continually weigh the risks and the benefits. Does the drug cause nutritional deficiencies? Are you increasing your risk of cancer or heart disease? If so, seek out some other alternatives. One more thing I want to tell you about. With statins, there's this thing called the number needed to treat and the number needed to harm. So the number needed to treat with statins is this. It's 100 people need to be treated for one person to benefit from a statin. So yes, there are benefits, but 100 people need to be treated for one to benefit. What's the number needed to harm with a statin? 1 in 10. That's right. So that means 1 in 10 will be harmed by a statin so that 1 in 100 can be helped. Does that math make sense to you? Doesn't make sense to me, because heart disease is caused by oxidated cholesterol. And that's a whole different story. So antioxidants, a lot of fruits and vegetables help you with that. Okay, for more inspirational tips, visit my blog, exploredrnorthrup.com, where you will find wisdom for your body, mind, and spirit, and discover the connection between your thoughts, beliefs, physical health, and life circumstances. And remember, you are in the driver's seat of your health, not your doctor. And achieving health can be easier than you think.